Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Larynx, we are comparing the adults versus the infants. So first, let's talk about the normal adult. So in terms of adult, the position is opposite to C3, C4 and it is omega shape. The thyroid cartilage is flat, TC is flat. Then when you look at the larynx is going to be conical. So what is the narrowest part? The narrowest part is going to be the subglottis. So how is the submucosal tissue? The submucosal tissue is going to be more and it is loose. So how is the laryngeal cartilages? The laryngeal cartilages will be soft and it will be collapsible. So just to recap some points, in terms of the adults, it is C3, C4 omega shaped, that is epiglottis. Thyroid cartilage is flat, then comes the narrowest part being the subglottis. The laryngeal cartilage will be soft and collapsible. Now let's move on to the adults. So this was actually the infants. So next we are going to look at the adults. So previously what we discussed was the infants and not the adults. It was the infants. So we covered infants. Now we look at the adults. So here in terms of adults, they will be opposite. So adults, it is going to be opposite for the C5 and C6. So it will be opposite to the C5, C6. Next we look at the epiglottis. Epiglottis in adults is going to be leaf shaped. It is going to be leaf shaped. And the thyroid cartilage is going to be angulated. The thyroid cartilage will be angulated. So how is the larynx? The larynx, if you see, is going to be cylindrical. This will be the larynx. It is going to be totally cylindrical. And next is the narrow part. So what is going to be very narrow? The narrow part is going to be the glottis. Next is the submucous tissue. The submucosal tissue will be less. So in terms of infants, the submucosal tissue is going to be more. Here is the submucosal tissue is going to be less and it will be dense. Then how is the laryngeal cartilage? The laryngeal cartilage here is going to be hard and it is ossified. So it is going to be hard as well as it is ossified. So now to recap in terms of adults, it is opposite to C5, C6. The epiglottis is leaf shaped, then the larynx it is cylindrical. Next is the narrowest part is the glottis. Whereas in terms of children, it was subglottis. Subglottis, here it is glottis. Then laryngeal cartilage is hard and it is ossified. To learn and grow daily like this, please do subscribe.